Hello everyone. My name is Nicole DiMuro and I researched older adults and their information-seeking behaviors. According to the Pew Research Center, there are roughly 62 million older adults over the age of 65 in the United States. This is important to note because it shows just how vast this user group really is, and by understanding their information-seeking behaviors, information specialists are better equipped to offer solutions in order to help them in their information searching. So through research, seniors search for information regarding health, and that includes treatment, health concerns and conditions, nutrition, and side effects from medicine. The first graph from the Ikejiman study shows that the participants in that study were mostly looking for information regarding health conditions. Older adults also look to people and places for information, and that includes healthcare professionals, in-person conversations facilitated by opportunistic discovery, as coined by Passelador. Essentially, opportunistic discovery is when an older adult speaks to another friend or colleague and they are presented with information that might pertain to them, and they essentially file it in the back of their head and they start looking into that topic at a later date. They also look to family and friends, the internet, and popular media such as television, radio, books, and magazines. The second graph from the Ikejiman study shows that family members, radio and television, and physicians are overwhelmingly sources that seniors look to for information. Through research, it was also shown that elderly individuals encounter barriers that actually impede their information searching. One such barrier was technology. Now, that's not to say that the internet itself was a barrier. There are a lot of studies, such as the Choi study, that shows that elderly individuals were able to navigate the internet for information. It was actually the health websites that they encountered that contained a multitude of health jargon that caused this sense of increased information anxiety, as pointed out by Kayesi and Matas. Another barrier that was notably encountered was the insufficient access to materials. So some older adults look to physical entities to search for information, and that's usually in the form of books. In studies such as the Ikejiman study and the Kuskis study, they pointed out that there was a lack of large type printed media, as well as printed media in native languages. So by going over the information-seeking behaviors of the elderly, such as what topic they are looking for, who they look to for information, as well as the barriers they may encounter, we can now offer some solutions to aid in their information searching. One such solution is the increased access to resources, and that can be done in two ways. One way is through doctors. So doctors are a very reliable source for health information for elderly. So when an elderly patient goes to a doctor, they can actually be given a list of reputable websites for elderly patients to look through. And this can be done digitally for the more tech-savvy older adults, or you could receive a physical copy like a packet. And essentially, within the packet, there will be a list of websites that are reliable for health information. Additionally, doctors can also provide simple term definitions for some of the jargon that the elderly will encounter on these websites. And this will actually aid in lessening that information anxiety that was spoken about. Another place where we can increase access to resources for older adults is through libraries. And we could create a training program for older adults to help them find information on the internet. Again, this is mostly for the older adults that are not fluent in navigating the internet. This can be done through online pre-recorded modules or in-person classes that are hosted by the library. and they will be able to teach seniors how to navigate online resources. Additionally, this in-person environment will give older adults the chance to converse with one another, and this will foster an environment perfect for opportunistic discovery. So they'll be able to find information almost anecdotally, and then from there, they will be able to look for even more information on their own at a later date. Another solution that can be put forth is the acquisition of more accessible printed materials. So, to reiterate, some older adults express a lack of materials, and that's usually in the form of the large print books and media that is transcribed in native languages. What libraries can do, local libraries at that, can have a survey that elderly individuals fill out, and they can specify what format they are looking for, such as if they wanted printed media or if they wanted certain websites, and the libraries can actually keep track of that, so that way they can update their collections and keep them relevant for their user groups. So by doing a survey, libraries will be able to meet the information needs of their local seniors. So by looking at the information-seeking behaviors of the elderly, it is shown by research that elderly individuals are mostly looking for information regarding health. And they look to many different facets to get that information, and that includes healthcare professionals, in-person conversations, family and friends, the internet, and popular media. They also encounter numerous barriers, such as technology and an insufficient access to materials. By offering solutions such as an increased access to resources and the acquisition of more accessible printed materials, we are able to better aid the elderly in their search for information. Thank you, guys.